Yesterday, I also announced our framework to lower health care prices for all Americans, including those in rural America. And we're calling it the Great Health Care Plan. You know, we had to come up with a name, and everybody wanted to say, oh, well, can we put something about lowering costs, because we're lowering costs very substantially. So I had Bobby and I had Oz. We had everybody in there. We had a whole group of people and were trying to come up with, so we're saying, the cost reduction plan that gives you good health care. And I said, it's too long. It's not going to sell. I said, we had more plans. And they wanted to get the words cost reduction in there, Lola, especially you. They wanted cost reduction in, and then they wanted great health care in. I said, look, you can have one or the other, but it gets too long. We're talking about the name of a plan. So we got it down to 7 or 8 words, and which is far too long. Nobody can remember that much. And I said, how about just call it, because this is the Great Health Care Plan. Now, a great plan has to be cost-effective, otherwise it can't be a great plan. That's the way I looked at it. So we have a very glamorous name. It's called the Great Health Care Plan, not the Unaffordable Care Act. I don't like that name. This is called officially the Great Health Care Plan. That means low price and great health care. So you're going to have, at a lower price, great health care. First, our proposal codifies the massive discounts on prescription drugs that my administration is achieving through our most favored nation provisions. Okay, we can go into this. We can go into this for hours, but the bottom line is we'll be paying the lowest price of any nation in the world. Whoever's paying the lowest, we match it. This could have been done years ago. I was going to do it in my first administration, but when COVID came toward the end, I said, I can't believe it wasn't it wasn't exactly a good time to be doing it. I said, why isn't somebody doing it? And the reason they're not doing it is that no other nation would agree. France, as an example, paid 10% of what we paid. Germany was paying 13 or 14% what we paid. In other words, we paid many times more, not a little bit more, not 10% more, 10 times more. A pill would cost 10 times more in New York than it would cost in London, as an example, than it would cost in Munich. And this went on for many decades. This was right from the beginning. And the reason it went on was a little bit of the healthcare companies, but it was other nations, and I understand that. If I were heading Germany, I'm not going to double and triple and quadruple my healthcare. They got the healthcare companies to pay. It just took place over a long period of time, got worse and worse, and it just hit numbers that were just absolutely unsaleable. And if you remember, the doctors in the audience remember, they say, well, we have to do research and development. I said, well, what about research and development for Germany? Well, we've decided to put up so the pill would cost 5 times more because of research and development, and 5 times more for other reasons. They had all these phony reasons. And finally, I said to the healthcare companies, we can't do it anymore. We can't do it. And it started, really, I tell the story. It wasn't meant to be funny. People find it funny. But a friend of mine who's a very smart guy, very, very rich, very powerful man, actually, but he was very fat. And he took the fat, I call it the fat drug. I won't give you which one. It was Ozempic. I won't tell you that. And he went to London on one of his many business trips. It's all he does is business. He can't walk across the street, but he's a great businessman. And he said, President. I said, what? He used to call me Donnie. Now he calls me President. So I said, you've come a long way. He goes, but I have a problem. What's your problem? In New York, I pay $1,300 for this drug. Now, this means nothing to him. This is like a penny out of your wallet. The guy's worth hundreds of millions, billions of dollars. He said, and in London, sir, I pay just a fraction of that. I said, what are you paying? $87. I said, well, is it the same drug? I knew exactly what he was getting at because it bothered me for a long time. He said, it's the exact same drug. And because of his wealth and his business smarts, he had it checked. It was made in the same plant by the same company. It's identical. And here I pay $87, and in New York I pay $1,300. So it was too much to bear. because after I told him that the drug does not work on him, because I saw him recently, he's actually fatter than ever. I said, the drug is not working on you. You're going to have to go to something else. But it does work on a lot of people. And he said, thanks, you make me feel good. I said, well, I got to be truthful.